Hello, good evening, everyone. Those who have logged in from India and nearby, good morning to everyone. Those who have logged on from the other part of the globe. Myself, Atri Gangopadhyay, pulmonologist based at Ranchi, Jharkhand. We bring an exciting webinar today. We are going to talk about career options for budding pulmonologists. Often, people do their post graduation for the best of institutes, but there is no placement guidance in many parts of our country. So they don't know after their degree what to do. Sometimes they spend precious months or years trying to figure out what to do, then maybe change a track. So it is very important that MBBS people, while entering pulmonary medicine, know about the scope, and people who are pulmonologists, by the end of the training, you should be able to understand which direction you want to go to. I will give a brief introduction first, and then we shall go to our various panelists for today, who will be your career guides for today. First, I would want to reach out to all our MBBS students or MBBS graduates. Why choose pulmonary medicine as a career? I am 25 plus, have completed my MBBS. My parents may retire soon. My school friends are earning since last 5 years. Unfortunately, I may have developed a comorbidity requiring regular medical attention. These are the things that go in mind when an MBBS graduate has completed internship, receives the permanent license number, and then begins the battle for post graduation. So, why select pulmonary medicine? In pulmonary medicine, there are multiple courses. Even a 2 years diploma can be considered a specialist. Then there are 3 years MD or DNB courses. Or you can even do 3 years postdoctoral DM after your MD plus DNB. So there are lots of degrees to choose from in pulmonary medicine. Just like this famous character in Indian film industry, Bahubali, I consider a pulmonologist as the most powerful doctor nowadays. And why? Because of air pollution. Every day we are reading headlines regarding how air pollution has become a menace in various parts of the country. The people who deal with these diseases are pulmonologists. As long as there will be deforestation, there will be urbanization and more of construction, and all these things will lead to climate change. All these climate change actually affect the respiratory system. So diseases of respiratory system due to climate change are increasing. COVID was a respiratory virus, but after COVID and before COVID also, there are many other respiratory viruses. And if there has been a pandemic that almost brought the earth to a standstill, then in future there can be other respiratory virus outbreak also, and no one to better tackle them than pulmonologists. Not only that, even now people are facing difficulties and problems due to COVID, even after 2 3 years of the onslaught. Due to increased lifespan, there are more of infections. Due to increased lifespan, there are more of organ transplantation and its complications, other organ damages which can affect the lungs, need for critical care patients, and cancer survivors. So, as the human lifespan has increased, the scope for pulmonary medicine has multiplied many a times. When you enter pulmonary medicine, and we are thinking about what to do after pulmonary medicine, I want to briefly mention the various scopes after completing pulmonary medicine: tuberculosis, obstructive airway disease and allergies, interstitial lung diseases, sleep medicine, intervention pulmonology, critical care, infectious diseases, cancer care, pulmonary vascular disease and coordination with cardiology, pulmonary function testing, drug and clinical research. I will not multiply these points because our respected panelists are here who will tell about all these panels today in the next 1 to 1.5 hours. So, now I would want to introduce our various panelists for today. We have Professor Dr. Radha Munje from Nagpur. She has built her career. She has almost completed her career in teaching at medical colleges, and now she is into public health administration. So, if you want to enter a medical college or go into public health administration, Madam Dr. Radha is here to guide you. Also, she is one of the forerunners of tuberculosis in our country. So, she can also guide you regarding a career in tuberculosis. We have Dr. Vijay Kumar Chennamchetty from Hyderabad. Dr. Vijay Kumar Chennamchetty is working at a private hospital in Hyderabad, which is also a medical college. He is one of the pioneers of intervention pulmonology, trained with the best people in Europe and USA and in India CMC Vellore. So he will tell you about how to build a career in intervention pulmonology. Also, he has been running a DNB training program for a long time, so he can even guide you regarding the same. He is also an entrepreneur having his own diagnostic center, so he can give you a few tips regarding how to manage celebrity patients, regarding how to also become a health entrepreneur. We have Dr. Shivani Swami from Jaipur. Dr. Shivani is based at a private hospital at Jaipur. She can tell you quite something regarding corporate career. She is also one of the pioneers of sleep medicine in India, and they had recently conducted an international conference of sleep medicine at Indore recently. So she can tell you regarding sleep medicine also. Then we have Dr. Komal Shah from Nasik, Maharashtra. Other than being a pulmonologist, Dr. Komal Shah is also a reputed infectious disease specialist in our country, and she works a lot inside ICUs. She is the right person who can guide you regarding infectious diseases, who can guide you regarding critical care and pulmonary medicine. Then we come to Dr. Joydeep Ganguly from Baharampur, West Bengal. Dr. Joydeep started his professional career at a medical college in rural India. So, if some of you want to make your career out of the big cities, want to make yourself big in rural India, Dr. Joydeep is the best person. Starting from a medical college in rural India, now he runs his own private practice. He does bronchoscopies and interventions in rural India. He has also built a complete pulmonary function test, including advanced tests like oscillometry and diffusion capacity in rural India. So he can guide you regarding how to be a pulmonologist, how to do a practice in rural India. So now we shall get to the panel discussion, and it shall be a wonderful, exciting evening, everyone. So thank you. And now we shall go to the questions. Before we go to the personalized questions, all of our audience today are very excited in knowing that how can a anonymous MBBS graduate become a celebrity doctor in the country. So, one by one, I would request all our respected panelists to first of all, Radha ma'am, kindly tell us a little bit about your career journey and what you think were some unique points that differentiated your career from your batchmates.
Yes. Thank you, Dr. Atri, for that question. And I'm sure when I tell about how I entered pulmonology way back in 1986. I'm sure few of the audience may not have been born at that time. So, so my career had already begun when you had stepped into this world. So it suffices to say that I have seen the dark corridors of TB hospital which you can have. But I was very lucky that I was student of one of the most prestigious institute, which at that time had the biggest hospital in Asia, which was the Government Medical College in Nagpur. We had a diploma in TB and chest disease way back at almost 20 years even before I joined. And luckily, we had very good teachers. And they were the ones who really evoked our interest in that subject. Initially, whatever we learned, we were all short sighted. So, everything what we wanted was to learn to pass the MBBS exams. But once we passed the exams and went to the internship, and we really had a hands on experience, because at that time, the interns were really, really supposed to work and do clinical work also. Luckily for me, and at that time, we did not have entrance exam pressure. So, practical experience was very important. And many of my colleagues, even in spite of being MBBS, they could not pursue or they did not pursue post graduation for one way or the other, one reason or the other. They are doing a wonderful job as a family physician. So it suffices to say that the clinical training which we got was really good. And that was one of the reasons that I took up a diploma in TB and chest diseases in 86. After that, I did my MD in general medicine, which I passed in April 1990. With an experience of working in both departments, the internal medicine as well as respiratory medicine, I do not know what insight I had because even today I do not know why, but I definitely knew that I wanted to be a pulmonologist and did not want to pursue ahead as an internist. Mm. I don't know the reason why, but whatever I have learned in medicine, I could apply it well when I was progressing in my career in the pulmonology. We started with MD chest as late as in 1992. And GMC was the only college in Vidarbha who had MD chest at that time. Then there was MD only in Pune and Mumbai. In my own college, I started MD as late as in 2014. But it was a belief for me to learn, a belief to teach because I was already a teacher and this was a very planned journey of me to be a teacher. And hence, I always aspired to have one of the best departments so that the student who goes out should be well equipped and well trained in pulmonology. And second, importantly, or I should say equally important, is that my patient or the patient who comes to my department should get the best possible diagnosis and management, whichever is available there. And third, most important is I never fail to inspire my undergraduate students who come to me to get their registered signed of internship. And whenever they are at crossroads and not able to decide, आगे क्या करना है, I always tell them, have you gone in the department? Have you worked at each site, like the ICUs, the DLCOs, the SCOPs, the OPD? And then I ask them, if you have looked, you should also think about pulmonology primarily rather than opting for pulmonology just because you are not getting medicine or any other branch that you wanted to be in. And I'm sure I would keep on inspiring as long as I work as a teacher. But definitely the journey from dark corridors that we had to most illuminous branch that we are in now and everybody envies us has been, for me, it has really, really been a very good journey. And actually, I really do not have anybody to blame for that I did not get this opportunity, or I could have done something better or more. I have, I mean, luckily I did not come across a situation or a person for that matter. So I think that all those who have logged in, who are already in pulmonology, should be happy where they are. And we should continue to inspire people to take this up primarily, because if this is your first choice, you would always do better and better in the branch that you have chosen.
That was wonderful story, and I was also born in 1986, so that was a wonderful story. From there, I would want to move to Jaipur. Dr. Shivani, how you can tell us regarding your journey?
So to be honest, when I finished my internship, I did not have the clarity of what I want to do next. So once I had cleared my pre-PG entrance, I had a few choices to take, and honestly speaking, respiratory to me came as a very practical choice rather than that which at that point, of course, I thought that of course TB is quite common in India. Lung cancer, COPD, asthma are all on the rise, and hence, and definitely, I think what actually was most attractive to me at that point was that this was a terminal branch. I thought, oh, this is excellent. I don't have to do MD and then do super specialization. This is as good as a super specialization by itself in 3 years. So that is actually what tempted me. But once I got into respiratory, I think it was such a good balance of doing not just OPDs or like a physician kind of a thing, but also great procedures, good exposure to everything. So I think this was actually a perfect balance of being a surgeon or a physician, and which is what was most attractive about the branch to me, and that's what actually keeps me going till date. That I think it's a very good balance of both the things. Once I had finished my MD, things actually just fell in place. I was always told by my seniors, by my very respected teachers, that you must have some more ICU experience other than from what you have had during your PG. So there was no obvious choice. It was just, like on a spinal level, that once you finish PG, you do some more ICU. So I did some ICU for 6-7 months while at Batra Hospital, Delhi, after which I joined Medanta, and there I got the opportunity to also do my sleep fellowship. So that was a 1 year ISD run sleep fellowship at that point. Me and Dr. Vijay were both together in that. We were the first batch. So I was very fortunate to get it at that point and do that. After which, of course, there has been no looking back. Once that I got into sleep, I think Dr. Himanshu Garg, who was my mentor, his passion for sleep was contagious, which had actually rubbed off on me, and that passion still drives me. And one thing that I learned very early from Sir was that if you can only excel in something if you're passionate about it. So all my postgraduate students who are logged in today, I would only want to say that only pursue something that you're passionate about. If you're not passionate about it, you would not be able to do it for the rest of your life. This is actually that kind of a decision. So that was my journey actually, and I'm still enjoying every bit of being in pulmonology, also doing pulmonology, a bit of interventions, sleep, allergies. I'm doing everything. But if you ask me, of course, sleep is what my passion really is. And of course, if I'm given a second choice today, I don't think there's anything else that I would want to do than what I'm doing.
So what we learned that one person had made medical college teaching as the primary thing. The second person made sleep medicine as the primary thing. Now I would want to go to Hyderabad. Dr. Vijay sir, little bit from your side.
Yeah, Atribai, first of all, let me appreciate you for, as usual, uh, brilliant moderation skills, and also the way you presented in a very, very crisp manner the scope of pulmonary medicine. I totally appreciate that. And sincerely thank Krishna Anna and my dear friends here, Shivani, and the entire team for giving me this opportunity. So if you see my journey, if you want to know my journey, so first of all, I must thank my mentors, as Dr. Shivani was clearly mentioning, my gurus, in fact. So I learned many things from my gurus, particularly after entering into critical care. Dr. Ram E. Rajgopalan, who is the number one forever in India for critical care, and Dr. Mahendran sir from Sundaram Medical Foundation, and my teachers at CMC Vellore, and Dr. Sai Indamuri, my good friend and my mentor as well, and my guru in pulmonary medicine, that is none other than the stalwart Dr. G. Ravindra Babu Garu, okay, who was my head of the department, and even today I store his name in my phone as a tiger. Okay, so the way they have created passion in this particular branch is amazing. And when I was in, I must tell you why the passion behind pulmonary medicine for me is when I was in, I think, +2, what has happened is I developed severe allergic rhinitis and then consequences of severe allergic rhinitis, which was totally cured after a good medications, and also I have undergone a septoplasty surgery, okay, then in my hometown, Tirupati. So at one point of time, I was an asthmatic. Okay, I used medications, inhalers for asthma as well for very brief time during that episodes of my staying in Ongole, which is a coastal region. So then entered into medicine, and then after finishing medicine, in the counseling time, I had an opportunity to enter into MD Pediatrics, MD MS General Surgery, MS OBG, MD Anesthesia, including at Usmania. Okay, but I have selected pulmonary medicine thanks to my maternal uncle, Dr. Satyanarayana Garu, who is my mentor behind choosing this. And another stalwart who has inspired me is Dr. Premanand from Tirupati, who is having roaring practice, roaring name and fame for the past consistently 30 years. So, and coming to many of questions were there while choosing, because the most important question which I was having before entering into pulmonary medicine is a fear of contracting infectious disease like tuberculosis. So that was there for a brief time. But of course, if we wear a proper surgical mask, or whenever you are entering into MDR wards, probably using N95 mask, these kind of things, reassurances from my seniors, my assistant professors, associate professors, then it has helped me to move away from that unnecessary panic situation. And in retrospect, I have developed a continuous, relentless nature of hardworking in combination with a lot of passion and enthusiasm towards this department, which has made one of the finest pulmonologists of this region. And as everyone was mentioning, I don't have any regret. If God has thrown me back to MBBS, I would love to do again pulmonary. I will choose as a specialty as a pulmonology to excel in the career. Over to Dr. Atri.
Wow, that was a phenomenal story. That was a wonderful, phenomenal story. Now I would want to go to Nasik. Dr. Komal, please.
Hello, everyone, and thank you for giving me this opportunity, especially Atri sir and all the CCI teams. So my story is a little different. Unlike others, I did my post graduation after my marriage. So I was like my husband was doing DM in critical care that time after my marriage, and I started working in Jaslok Hospital as a intern. No, not as an intern, but after internship, I was doing plain post in the ICU. And that time I met Dr. Chitnis and Dr. Mathur, who were heading Department of Pulmonology at Jaslok Hospital. And I was very much impressed by them. And fortunately, I got selected for DNB at the same institute in Jaslok Hospital. So that's how I went into pulmonology post my marriage. It was by chance, but then I really started enjoying working with them. And I got first rank in all over India in DNB. So that's how I got the gold medal. And after that, I started, it was in 2013. And then I did my FCCS also. And I started working as a critical care specialist pulmonologist in the medical college. So I started as SR and gradually, uh, my voice is clear.
Yeah,
Am I
yeah.
audible?
Yes, yes.
Breaking. What you can do is put off your
Am I
video
audible?
and then talk.
So should I?
Okay,
Komal,
as she
just
is reconnected.
take off your AirPods and then speak.
Maybe I can
Yeah,
switch
as
the device.
as she is
Then you
reconnecting,
can continue.
we had another fifth panelist today, Dr. Joydeep Ganguly. But due to some legal problem in their vicinity, the internet has been suspended. So that's why he had to leave. And he has been called for emergency duty in the hospital also due to some legal problem. So let's just hope he and his family remain safe. And by the time Dr. Komal is reconnected, let me try a little bit regarding my journey. Okay, Dr. Komal, you have come. Yeah, please.
Yeah. So can you hear me?
Yeah, yeah, we can hear you.
Can you hear me, sir?
Yes, clear, clear, clear.
I think Dr. Komal cannot hear us.
Okay, that may be some problem. Okay. So I grew up at Ranchi, Jharkhand, and I had done my MBBS from Guwahati, Assam. So from Ranchi to Assam, that day there was no single train. I had to change one train in between. The two train journey used to take around 30-36 hours. And while crossing around 8 to 10 hours in Jharkhand, I used to see lot of these coal mines, sand mining, thermal power plant, steel plants, glass factories. And I used to think that there are so much industry in our state. Pakka air pollution hoga, lungs में problem hoga. So even in MBBS, in community medicine, I was attracted to occupational lung disease, ESI scheme, all those things. And while doing internship at Guwahati, there was this gentleman, perhaps he was my career changing guy, Dr. Kripesh Ranjan Sharma. I had requested him also to come today, but he is occupied for a physical conference today. So Dr. Kripesh had just completed his MD and he had joined Guwahati Medical College as Assistant Professor Pulmonary Medicine. And I had taken that 15 days elective posting TB and chest. And Dr. Kripesh told us that whatever subject you take in future, at least I am going to tell you the scope. And he told me that other than tuberculosis, what are the various scopes in pulmonary medicine? So then I realized that if I want to return to Jharkhand, where there are so many mining, so much factories, and if there is so much scope in pulmonary medicine, let me take that. And maybe that is what pushed me into pulmonary medicine. And CCI has also been a part that CCI, at least via this close network, I am connected to people pan India. So getting patients from various parts of the country was never a problem. So that is also something which helped. And now it's been almost 7 years that I'm practicing as a professional at Ranchi. I would always say that this is a wonderful branch. I think someone has logged in from two devices.
Devices, yes.
I think someone has logged in from two devices. That is why the voice is coming like that.
I
Yeah, now
think
it's
so,
gone.
Ranchi.
Yeah, yeah. So what I was telling that this is such a branch that you are part surgeon also, you are part physician also, you are part critical care also. So that is something which I find very interesting and entertaining. And I would definitely encourage any youngster who comes to me regarding this subject. Every subject may have some pitfall, like someone very lightly mentioned that regarding this fear for contracting TB or infection. So, but still, whatever challenges are there, somewhere this is a very fulfilling subject. You get time for your family also, and you get time for your patients also. And you also get time for learning activities, seminars, conferences also. So if Dr. Komal, your connectivity has come, I will request you to please continue. You were telling how you were doing critical care specialist at Bombay.
Hello. Can everyone
Yeah,
hear me now?
we can hear you. We can hear you
Yeah.
clear.
So I don't know how much I said earlier, how much you could hear, but basically I started as like I had no option but to take pulmonology because my husband was already doing DM critical care at the same hospital, and I was working as a plain poster in the same ICU. And I came in contact with Dr. Chitnis sir and Dr. Mathur sir, who are Dr. Chitnis sir is no more there, but they are the pioneers of pulmonology in Mumbai. And I was so much impressed with them that when I got the opportunity to take DNB at Just Look, I just grabbed it. And I really, really liked working with them. They've taught me so much. So in 2013, I completed my DNB, and that time I was the first ranker in all over India to complete the DNB pulmonology. And after that, I started working as a pulmonologist. I did my FCCS, also did a fellowship in allergies and immunology. For 10 years, I've been working in medical college as SR, then assistant professor, then associate professor. And after that, in last 3 years, just before 3 years, we moved to Nasik for certain reason. And after coming here, it was just post COVID times when me and my husband both realized that there was some gap in knowledge, gap in a way that we were seeing more and more of the pulmonary infections in the ICU, and in general, there were more resistant organisms. There were more new tests like PCRs, which we did not know how to deal with. Then there were DRTBs and difficult to treat Pseudomonas kind of infections. And we had no one to guide that how to go ahead with that. And that time we realized that there is a need of infectious diseases specialist in our field also. So I did my fellowship in infectious diseases from CMC Vellore with the point of view that it will help me dealing with pulmonary infections better in my ICU and in my patients. So I did it from CMC Vellore, but the good part of it is that I started dealing the pulmonology patients much better than what I did initially. But I also started dealing with other patients other than pulmonary, like extrapulmonary infections. When there are resistant organisms, when there is MDR, when there is this Crohn's and community acquired resistant pattern. So we started with antimicrobial stewardship program also in our hospital, and it has helped me like anything. So, as Nashik does not have any infectious disease specialist so far, so I started like my practice 5 times more than what I had been doing previously. So this is my journey so far.
Wonderful. So it was great to listening to everyone. One message which I want to give to the people listening to us is that it is very important to fall in love with the subject. Secondly, even inside a vast subject, you can single out a part of it, a subunit, a chapter, and then you can make that chapter as your strongest point so that in your area, everyone will consider only you for any disease coming from that chapter. Now, I would want to go to Dr. Radha, ma'am, how we should enjoy one's work in pulmonary medicine.
Yes. For that, first and foremost, you need to make your mind that you are in a field which you have chosen to be. And now that you are there, you are going to give your best to your patients and to your colleagues also, and in your work environment. Once you have decided you are going to give out the best, the results would also be equally good and it will give you a joy. You need to be happy to keep others happy, and in turn, the others would keep you happy. So, first and foremost, is your target should be of being happy. So, your happiness comes from doing good work. Your happiness comes from being honest with what you are doing. You should know your own limitations. कि हम ये जो कर रहे हैं for a particular case or a particular patient or in a particular situation, whatever I am doing is the best. इससे ज्यादा मैं ये situation में इस घड़ी में इसके लिए नहीं कर सकती. If that is so, then you would not feel कि भाई मैंने ये करना चाहिए था, because we always are thinking about, it's very easy to say that when you go home, you leave your working issues behind. वो ऐसा होता नहीं है. You keep on thinking about your patients, the situations you have dealt with. So you should learn to give your best, give your 100% at that particular time. उससे जो आपको satisfaction मिलता है, that will only bring you happiness at your workplace. And of course, I'm sure you are going to ask questions about work-life balance, so I'm not going to put anything related with that. Second important is for you to be happy. Your whole team needs to be happy. And you need to recognize the importance of each person who is in your team. वो आपका attendant हो, receptionist हो, staff nurse हो, respiratory technicians हो, OT assistant हो, whatever. ये सबको you should be open enough to let them know what you expect from them. You should let them know in which way you want them to work and how they should all be reporting to you for even the smallest and of course for the big things also. If you have good communication, you would have a good working atmosphere. So that is very
Thank
important.
you. Yeah. So one thing, Dr. Shivani, you were telling that when you had joined this subject, it was considered an end branch. But nowadays we see a lot of people who are pursuing DM. So can you tell us, after doing a post-graduation in pulmonary, what may be the various super specializations?
Right. So I think, of course, like you correctly said, Dr. Atri, that DM definitely is one super specialization. And there's also DM in critical care and not only in respiratory medicine. So that's something that, of course, our MD colleagues can look at. But it's not just super specialization in terms of postdoctoral degrees like DM, but even otherwise, there are a lot of branches that the pulmonologist can opt for. So MD pulmonary medicine is actually also eligible for doing DM in cardiology. So that's also one option. But also there are these small fellowships, these short fellowships, which could be 1 year, a few months, that these RPGs can actually look up to, depending on what they're passionate about, which obviously the hot cake amongst all definitely remains interventional pulmonology. But other than that, there is infectious diseases, there is sleep, there is also allergies. And apart from that, as you have discussed, that people can also choose their own area of interest, like ILD, obstructive airway diseases, and other diseases, and just make their own niche branch, and of course, at the same time, do the rest of the pulmonology work, but then have an area of interest and develop over it.
Wow. So other than DM in critical care, cardiology, and DM pulmonary, there were so many other things that you told us. Dr. Vijay, you have been training these DNB fellows, then fellowship fellows for quite some time. So, suppose someone decides that after this degree, I am not going to study and I need to work. Maybe I have responsibilities. So, I cannot afford to study after this post graduation. So, what should be the basic intervention skill a postgraduate must have?
Yeah. Very, very pertinent question, Atribai. So Radha Munje ma'am has also mentioned slightly. I want to take this question in a slightly twisted manner, in the sense many of the students come and ask me, sir, we want to, because most of us don't know, we are all mentors to many people. They want to become like us. They want to do like this. They want to read like this. They want like us. They want to practice like us. So invariably, we are influencing so many people. So when someone comes and asks me, sir, there is too much competition in the in this medical field. What is your take? Then I would suggest, my dear friend, there is a competition everywhere, but at the same time, when you become a holistic doctor, holistic in the sense, you have to attain the degree, you have to have enough skills. I'll come there. What are the skills that you need to have? You should have passion, as Radha ma'am was mentioning clearly. And the most important thing one need to have is empathy. So if you develop all these skills in pursuing your career, I don't think there is a competition. For a good doctor, there is a really less competition, and most importantly, you have to ensure that you are available at least a majority of time to the patient. Coming to skills, the basic skills which we need to have is, yes, apart from these skills which I have mentioned, so bronchoscopy and simple ICD placement and conventional or a blind pleural biopsy using Abraham's needle or Cope's needle, and therapeutic aspirations, and sometimes, okay, it is very important. Another important skill which through which you can create a lot of impact in the society is thoracoscopy. At least, if not advanced thoracoscopic procedures, you need to learn how to do a biopsy. Over to Atri.
Wow. So very practical, very enlightening. I just now came to know from the technical team that 1121 people are watching us live now currently. 1100 plus people are watching us currently. So that's a phenomenal number. Great job, all of you. Also, great job, everyone who are in the background. Dr. Komal, you mentioned a very important thing that you and your husband were so bored of seeing these Bollywood film stars that you were fed up of Mumbai and you had to change to another city. So, in medical career, sometimes due to entrance exams, sometimes due to marriage, sometimes due to job opportunity, we need to leave the city of our childhood and go and settle at some other place. So, how does this impact the career?
So it's a very valid question, sir. So I changed my city at the after 10 years of my practice. So it does have a major impact, especially on your family, on your practice, where you are working. But it also depends on what do you want to practice actually. So nowadays, in even second tier city like Nasik, we have many corporates, we have many medical colleges which give you good opportunities to grow and develop. Also, the advantage of these cities is that you get, if you want to establish your own practice, you get a good chance. Like you get good land, then there is a lot of manpower you get over there. There is a lot of drainage from the periphery. Though sir mentioned that there is nothing like competition, but obviously you face much less competition than metros when you are coming to this second tier cities, so you can develop yourself better, I would say, in this kind of cities. Plus there is lot of work satisfaction, in a way that you are doing some procedures which were not done before in this same city, so you have that kind of satisfaction. But if somebody wants to pursue their career in something very specific, like they want to do something in lung transplantation, then they have to choose metro, obviously. or they want to do something like the highest of the interventions, then there is no scope in other cities, but they have to go for the metro. But as far as work life balance is concerned, you can get the better opportunities, better satisfaction at the smaller places where you have more manpower, more chances, and you can develop yourself better.
Thank you. One correction from my side. The message of number of live logins was from Dr. Krishna sir. It was erroneous from my side. So Krishna sir sends his best wishes to all of you who are live today and also all the audience who are watching us today. So now I would want to move on to Dr. Radha ma'am. What is the importance of research during and maybe after passing post graduation? And should one mandatorily be involved in research?
To Atri for that question. And yes, research is very, very important because, as they say, you publish or you perish. Uske jaisa hai. Secondly, I, I, I know and I fully agree that each one of us who is not only on this webinar as a panelist or all those who have logged in, everybody has had their fair share of experience for those particular diseases, unke area mein, how people respond, how do they treat, how do they get the response to the treatment and all that. But unless this is documented, it is not accepted. Like if I keep on saying that I have seen so many cases of this particular disorder in respiratory medicine, and I know the best way to deal with it, or I know how to diagnose, or I know how to treat. So just saying this is not enough. I mean, we value experience, no doubt. अभी भी हम experience को उतनी ही कीमत देते हैं. But a methodical research or putting your experience, what I would say to research is, we have different type of research. First and foremost, one research which we never do is basic research. Basic sciences का जो research है वो हम clinicians कभी भी नहीं करते. It is done in the laboratories or it is done by the basic scientists. तो हम लोग कौन सा रिसर्च करते हैं? हम दो टाइप का रिसर्च करते हैं. एक तो हमारे पास जो डेटा रहता है उसको हम एनालाइज करते हैं, और सेकेंडली many of you or us get opportunities to do a pharma funded study, that is also research. Now there may be two thoughts, यानी there may be different thoughts कि कोई बोलेगा कि pharma funded study ये कोई research नहीं है. But believe me, whichever study you do and whichever research you do, it's definitely going to teach you something good and something concrete about research. So you would learn the methodology. क्योंकि आप जब पोस्ट ग्रेजुएशन करते हैं और जो रिसर्च करते हैं, दैट इज आउट ऑफ कंपल्शन. आपको डिग्री के पहले एक थीसिस जरूरी है, इसलिए आप टॉपिक लेते हैं. मोस्ट ऑफ द टाइम आपके पसंद का रहता है, मोस्ट ऑफ द टाइम आपके गाइड के पसंद का रहता है, बट यू कंप्लीट इट. तो वो थीसिस जब आप कंप्लीट करते हो, दैट इज द फर्स्ट टाइम इन योर लाइफ दैट यू लर्न टू tabulate, you learn to study with the graphs, you learn to deduce some inference, you come to some conclusion. However, of all these n number of, यानी अगर हम सोचे that there are 1,000 postgraduate seats now in pulmonology, out of this, I think hardly 1/5 or 1/10 gets published as a research. तो ये डॉक्यूमेंटेशन होना बहुत जरूरी है. इट्स नॉट इनफ टू हैव योर डेटा, इट्स नॉट इनफ टू हैव योर एक्सपीरियंस. यू हैव टू पुट इट मेथोडिकली, you have to learn to analyze, and you have to learn to interpret what you have actually learned or deduced in this. That research is very, very important because it may be very small. Let me quote an example. I don't know how far it appeals to you, but I always think that this is a very small, but a very interesting and a very impactful research. When RNTCP started, we were in the guidelines, it was there that you have to do 3 sputum samples. So one was the spot, the other was 24 hours overnight, and the third one was again spot when patient would bring the 24 hours sputum, right? This was happening. So now you know the burden of disease that we have, multiplied by 10 are the number of suspects that we have to screen to get them, and multiplied by 3, you have to see the sputum smears in the laboratory. So look at the workload and in which way it happens. Plus, it delays the report. Now, there was one good consultant, because I have not talked to him, I don't know whether I should be taking his name. Dr. Srinivas was one of the WHO consultants in Nagpur at that time. And what he did was he simply analyzed the advantage of doing the third sputum sample. And they analyzed data of thousands of patients, and they came to a conclusion that added benefit of third sputum sample is not so much, और एडिशनल बेनिफिट इतना नहीं है जितना कि हमको उसके लिए रिसोर्सेस लगता है, पेशेंट्स को टाइम लगता है, डिले होता है, एंड वी आर नॉट मिसिंग द डायग्नोसिस. एंड आफ्टर दिस स्टडी द गाइडलाइंस वेर चेंज टू 2 स्पूटम सैंपल. अब ये देखो कितना सिंपल है, आप और हम इसमें दिमाग भी नहीं लड़ाएंगे, राइट? सो this is a simple example of research which can be, impactful and change your approach. Of course, there is nobody stopping you from doing the third and the fourth and the fifth, a good sample. वो नहीं है, but guidelines को impactfully change किया है किसी ने. So this is a very small example. So I think research is very important, and I think that we have to change. हमको हमारा नजरिया बदलना चाहिए कि रिसर्च किसने करना चाहिए, या ये सब मेडिकल कॉलेज के लोगों ने करना चाहिए, टीचर्स नहीं करना चाहिए, उनके स्टूडेंट्स नहीं करना चाहिए, या जूनियर फैकल्टी ने करना चाहिए. ऐसा कुछ नहीं है. We have so many of our colleagues who keep good records of their cases. They report unusual cases, and they even do good research in various procedures also. Uska documentation karna. So this is, I think, a very important topic, and it's unending. Basically, research is unending, but I'm sure I have emphasized the requirements. Thank you.
Wonderful, wonderful. Dr. Shivani, ma'am, please guide us regarding what are the various courses for sleep medicine, how to pursue them.
Right. So I think one basic course that at that point was very popular, which me and Dr. Vijay both had done, was the 1-year fellowship, which was run by the Indian Sleep Disorder Association. It was 1 year was on-site exposure to the sleep medicine under your respective guides. At that point, I think it had 5 centers. So that was a very good course. And at the end of the year, you would have a theory and a practical exam both. That was a very good course. But apart from that, also there are now a lot of other options available, whether national or international. So there are multiple smaller courses that are available. Some of them are hybrid, which is like a combination of online as well as followed by at the end a short contact program, maybe 2 days or 7 days. And then a few of them are absolutely just hybrid, like the diploma in pediatric sleep medicine that Dr. Bharat Reddy does. So there are also other societies running their own short courses, which could be just a few online lectures or a couple of days of workshops. So there are plenty of options available on the national level. However, even the European Respiratory Society does have its own training modules for sleep medicine. So that is also another excellent options available on that, which is also, again, a combination of online lectures. Then there can also be a hybrid model that is there, that online lectures followed by a short training program. So these are various options that are available in terms of training in sleep medicine, which of course is a very extensive subject in itself. So hands-on is something that I feel that one must really have.
Thank you. Very precise, very clear. Dr. Vijay, nowadays that our country is offering everything what the world offers. Preference for abroad training or fellowship and then coming back to India. What would be your take on this? Because you have spent quality time abroad. And so your take on this.
Yeah, Atri bhai. Okay, very, very pertinent and very important question. So why do we need to leave this country to learn something extra? See, what is that extra that we are going to learn? First and most important thing is discipline, and then the way they do things different is definitely one we have to learn. So I have been to few centers for a for my transplant observership. I was in UT Southwestern Dallas, shadowed under my teacher, Dr. Srinivas Bolineni, who happened to be my 4 years senior at med school. He was really kind enough to grant this program for me. Really learned. For example, to quote an example, I was the first one who started doing transbronchial lung biopsies under fluoro guidance. Okay, back in after returning from UT Southwestern Medical Center, I started doing lung biopsies under fluoro guidance. Till that point, no one has started a fluoro guidance, which is the standard of practice, which is really safe enough and to avoid pneumothoraces. And then second thing which I learned in the same program is, okay, doing bronchoscopy, complex bronchoscopies, rather than on just sedation, converting into total intravenous anesthesia and doing using iGel. These are the two best practice which I learned in 2012 from UT Southwestern Medical Center. And I was fortunate enough to work with Dr. Hervedutov, Dr. Astol Philippe, and Professor Hesdel from Germany. And I was at Guangzhou, China, for learning my interventional skills. And of course, there are many other very, very brief programs which I have attended. And I was fortunate enough to work with Dr. Sai Endamuri, who was then a surgeon, thoracic surgeon working in US. He has relocated based on a commitment that we want to develop, me and Sai wants to develop a thoracic program in India. This was the first time a complete thoracic program was started in India by both of us at American Oncology Institute back in Hyderabad. So during that time, I learned a lot of rigid bronchoscopies, doing laser application in bronchoscopy, doing stenting, doing tumor debulking, and so on and so forth. And of course, advanced thoracoscopies as well, including additional lysis, lung biopsies. These were the things which I learned under Dr. Sai Endamuri. So definitely, Atribai, it is going to create an impact. And but one take-home point which I want to give regarding abroad fellowships is life is much, much happy and healthier and back in India rather than at other countries, because you have very good contacts, you have very good friends, and you can create a very, very great impact in homeland than at other places.
That was a very beautiful message. In fact, if we just refer to our CCI family, that whenever I go to a conference, I initially find out who will be there from CCI. That if 8 or 10 people are there from CCI, then we shall have a wonderful get together. So that was something beautiful. I totally agree with you. One message from all our specialists here is that post graduation definitely helps for a better career. But if you can select a sub part of post graduation and invest some time in getting extra teaching or extra training in that, then your career becomes very charmed, becomes very golden. Inspired from you people only, after COVID, I thought, let me try to do something new. And I took a very big risk. There used to be a machine that was only available in 10 or 12 corporate hospitals or medical colleges in India. And I thought, let me take a risk and bring this machine to my city at a clinic. And I brought the impulse oscillometry at my clinic. And some people advised me against that we don't know what this is. But I tell you, somewhere it helped shape my career. Somewhere it helped define how people started knowing me, how people started referring to me. So, wherever you are, if you have a target in which city you want to settle down, try to make a list what is lacking over there and try to see if you can deliver that service over there. Definitely, you will not get competition. Even others from your fraternity will start supporting you. So, Dr. Komal, ma'am, infectious disease is not just lungs, it can be kidney, it can be bone marrow. So, but do you feel that we are encroaching into other departments and how completion it is bringing to a pulmonologist also?
Okay. So, sir, I'll continue with what you were saying earlier.
I think we've lost Komal.
Place.
She is here. She is here.
Yeah. Am I audible?
Clear, loud and clear.
Komal, you switch off the video so that you
Yeah,
won't
I
have
think you
any
switch off
issue.
your video. That will improve your bandwidth.
Ha.
Yeah,
Okay.
yeah. Speak now.
Audible? Yeah.
Clear,
Yes.
clear. Speak.
Yeah. Clear. Okay. So, sir, I'll start with where you stopped. Actually, you gave a very, very valid point that select a city, start practicing what others are not doing or whatever is lacking in that city. That is a very valid point. So, I started doing infectious disease. I did my fellowship because I was feeling there is lacking of infectious disease specialist in my city, first thing. And second, I was not feeling complete because I could not deal with pulmonary infections most of the times, like the difficult ones, the MDRO ones, the ones where I was stuck. कि इसमें colistin देना है, polymyxin देना है, इसमें voriconazole देना है कि posaconazole देना है. So nobody was there to guide me. So now, if we see retrospectively, I'm seeing now that what patients I was treating 3 years back is much different than how I'm treating now in just pulmonology. Like, for example, I would say that I never knew that voriconazole is a pro-mucor drug. And even if I'm suspecting aspergillus, I should start with posaconazole. So this is such a simple thing which I was not knowing in pulmonology itself. Am I audible?
Yeah, please continue.
Yes, yes.
Hello?
Please continue.
Yeah, yeah.
Please continue.
So that way it has made a major impact in my pulmonology practice. And I don't think we are encouraging over other specialty, especially when you don't have such specialist in your place. So most of the times when we are dealing with patients in ICU, we are anyways dealing with infections of other branches as well. And if we are doing specialization in this field, we can manage them much better. Plus, one or other way, we are going to use any of the all of the antibiotics. And nowadays, we are getting so many resistant patterns. We have to deal with stewardship. So I think this is part and parcel of pulmonology. In addition to that, of course, there are extra pulmonary infections. But I feel that if we are able to learn those things also, it will add into your practice, whatever you are dealing right now.
Wonderful. Very clear. Thank you. Dr. Vijay, sir, from practitioner to entrepreneur, what should be the minimum years of gap we should, let's say, tread the waters before taking the plunge? And would you also recommend, let's say, some management courses or some non-medical courses if a doctor wants to become an entrepreneur?
So this is it depends on what kind of nature what we have at Tribai. So if we want to develop as an entrepreneur, it is very important to have that particular skill set. It is close to impossible for everyone to become an entrepreneur. That risk-taking behavior you have said very clearly just now. Okay, I could get iOS. Okay, at Ranchi, though it was you were thinking whether it is going to click or not, but you have analyzed the situation perfectly and then launched the iOS clinic at your clinic. So similarly, risk-taking behavior is the most important thing. And second important thing, persistence. So you may encounter for few months or few years, couple of years, some difficulties. But if you persist as an entrepreneur, definitely you are going to click. But what is the startup journeys in India? If you see, out of 100 startups, 95 are getting closed in less than 2 years. But this doesn't work with doctors, particularly after pulmonology. If they can start up a good clinic with a reasonable amount of probably X-ray, good quality pulmonary function test, good laboratory as a backup, I don't think they should look back to establish as a pulmonologist, particularly in two-tier and probably one-tier cities. Probably they may take time to establish in metros because metros are already, probably I can say, it is saturated um, significantly with the pulmonologists. OT. And
Wonderful,
I'm
wonderful.
sorry. So, if there is any course they want to do, I haven't done any course, but if any course they want to do, particularly IMS, IM, and ISB of Hyderabad, they're all offering very brief 6 months programs, 1 year programs in healthcare, so that it is a it gives a scientific approach to establish as an entrepreneur.
I always believe that training always helps, and knowledge is power. Knowledge is something very powerful. So if you get the opportunity, you can definitely consider that. Dr. Radha, ma'am, right from MBBS, what traits, if I have, then I should perhaps opt for a career in a medical college, teaching profession only.
I think uh, both parts. Like if you think you want to be a consultant and practice outside, or if you want to be a medical teacher in a medical college, you definitely need few sets, skill sets, which is very, very important. Uh, First and foremost is you need to be empathetic to your patient because that is what you are going to teach your students. When you go to a medical college, the teacher has two, three, four different responsibilities. One is undergraduate teaching, for which our specialty has very less scope because we have limited number of lectures. But me, when I started as a lecturer, as I said way back in 1990, from 92 onwards, only I started taking a lecture in a class of 200 students. So you cannot have a stage fright and think of teaching students. But that doesn't mean that you cannot be a good teacher also. Classroom teaching for a medical college is different, and bedside clinical teaching is something different. So there can be a teacher who is a very good teacher for bedside clinical teaching. So, but you need to have both these traits when you want to be a teacher. Third, importantly, is you need to have good administrative skills also. If you don't have, you should be willing to imbibe them and learn because you have to develop the department. You have to learn to manage interpersonal relationships in your department. Plus, you are a bridge between the administration, your department, and students in your department. So, for this, I think these three traits are essential. And sabse jyada passion to teach. I'm sure few of the audience who have logged in, few of them who have actually interacted me, including Dr. Vijay, they must have experienced how I love to teach and how I love to get that particular work done in a particular way. तो वो एक passion भी होना चाहिए. You know, if you have that passion, you would do your job well. And again, going back to my first question is, you would be happy. And of course, you have to be a role model for your students. You know, I became like, I did not say earlier, but my due regards to my professor in pulmonology, Dr. B.R. Maldure. Had he not been in a city like Nagpur, he would have been a person to reckon with. He was a wonderful teacher, a very dedicated, very humble, God fearing person. So he has actually influenced me in many ways. including writing papers and all. So you have to be, you need to be a role model for your students. तभी तो you would get good teachers in medical colleges.
So that's something wonderful that we must aspire to be role model. That is a very strong message. That is something very
I
good.
must add here something, Dr. Atri. It's not because I have spent long years, but many of my students are already professors and heading their pulmonology department in medical colleges.
Wow.
And
Wow.
I must say, one is in the south, the other is in the Vidarbha, the another person is in the north. And it gives you immense joy to see them establishing their own name in pulmonology. It's a joy,
Wow. Wow. So,
including
uh,
Rajesh. I mean, I shouldn't be taking names, but there are so many students who are really doing well.
wonderful. We have an audience question. Anand Keshav from Ranchi, Jharkhand. Any suggestion for new pulmonologist regarding books and basic concept building tools? Dr. Shivani, would you want to take this question?
Yeah, sure.
I Yeah, I think he must be an aspirant who must have qualified because just last week this NEET counseling result have been out.
Yes.
So most probably he has just qualified. Yes, please.
Yeah. So I think in terms of books, at least in our times, the basic go-to book was Fishman. But I think things may have changed now because I see my students reading Crofton and sometimes Jindal as well. So I think that remains. But then apart from that, there are very beautiful books for different heads. Like for pleural diseases, there's Richard Light,
Right.
which is considered the Bible, and it is such a beautifully written book. I practically have it in my head. It leaves that impression. And of
Very
course
good.
you have to read radiology. So something which is Felsen is the book for X-rays. Then of course for other diagnostic modalities there are different books. There are Tomans for especially TB Viva. There is Sharma Mohan for tuberculosis. You must read Gina and Gold guidelines because they keep getting updated. So that is also one thing. For ILD, at least what I read was the American Chest Clinics by Dr. Ganesh Raghu. There were 2 volumes. So that's what I read for ILD. So I think majorly those are the books that I at least refer to, apart from, of course, a lot of smaller topics like Tata McGraw for PFTs. There was different books for ABGs. So, a lot of other books. And for critical care, again, for ventilators, there is Chang, and I think for other topics there is Dr. Odwaria's very beautiful book. Some people also refer to the Oxford Handbook of Critical Care. So I think those are majorly the books that at least I can name offhand.
Wow. Wow. Any textbook is a good book. So if that textbook covers the subject, it will definitely add something to it. So we should always have this habit of reading. And nowadays there
Can
are
I
some
add?
wonderful. Yeah, yes, ma'am, please.
Yes. Something I really wanted to add here is Shivani. Apart from the books that we read for pulmonology, the first and foremost, which I feel the resident who joins pulmonology should read is the first chapters of Harrison, which focuses on fever, which focuses on general examination. तो वो जो छोटे छोटे टॉपिक्स हैं पूरे, that must be read, which is of immense help in understanding your patient's case scenario. And then they should read for all these things, like
I think also,
breathlessness
I think
explained,
that
fever
also
explained, pulse explained, everything.
I agree, ma'am. And I think also for clinical, rather than sticking to one book, they should actually read all the books because every book would give
Yes,
them an additional point.
yes,
So at least,
yes,
especially
yes.
for clinical, they should read all the books.
And one important book is West Physiology, which we used to
Physiology.
read in first year. So it gives very beautiful explanation of respiratory physiology, which is the base. And after that, we can start reading. So I always tell my residents to start with West Physiology whenever they are in the first year of the medical college.
Yeah, I would give a
We always,
secret tip here to our audience.
yes, yes.
Yeah, that CCI has done a webinar on West physiology.
Oh,
In fact, we
Uh-huh.
have done a webinar even on clinical science, Atri.
Oh, yeah, yeah, yeah.
History
So
taking,
those are
clinical
available on
science.
YouTube for anyone
And
because
X-rays
Yes,
also, I think.
classification of ILD will change, but the examination of pallor, examination of clubbing will have never changed. So that is available for any would-be students. The CCI, please subscribe to the CCI YouTube channel. I would request you because even in your off time, you can log in and watch these webinars, not only live. We
So
have a
I would
question
love
from
to
Dr.
add
Shushma
two
Duga.
more
Oh,
books.
Doctor, yeah,
Uh,
please, please.
I would love to add two more books. See, one thing is Critical Care from Paul Marino. That's one thing
yes.
which is a game changer in your life. And second important book, those who find it the ventilatory jargon as a difficult. Our own Indian pulmonologist, I cannot call him as a friend or colleague right now because he is such a senior like Radha ma'am. Dr. Ashfaq Hassan has written Basics of Mechanical Ventilation. If you read this book, I'm yet to listen from any student of mine that I haven't understood mechanical ventilation. Such a lucid and transparent, wonderful book. Please, if you want to gain experience in critical care, Basics of Mechanical Ventilation by Professor Ashfaq Hassan from Hyderabad. And then the second book is Paul Marino, Critical Care, the ICU book. Right.
Wow. So
Yes.
we have a question from Nasik, Dr. Shushma Dugar. So I would refer this question to our panelist, Dr. Komal. Please give opinion regarding fellowship in intervention pulmonary.
Sir, you asked the question to me, and the question is asked by my HOD herself.
Okay, okay, wonderful.
So, so many of our residents have done 1 year, 2 year fellowships in intervention pulmonology from various corporate hospitals from Hyderabad, from Bombay, from Delhi, and they've been doing good. So basically, again, it depends on what kind of practice you want to establish further in your life. So if you are going to practice normal pulmonology, where sir already mentioned that basic bronchoscopy, thoracoscopy, taking biopsy should be enough. But if you really want to do higher interventions, then you must be doing this kind of fellowships at least for 6 months to a year. Um, I think that should be sufficient.
Wow, thank you, thank you. I would want to go to Dr. Shivani. You are a very successful practitioner in your city. You also have a family life, social life. But because you're a pioneer in sleep medicine, whenever there is a conference in India, Dr. Shivani's name comes either as course director, course facilitator, scientific chairperson. So, how do you balance these traveling scientific program with your practice for the juniors, please?
Yeah, so I am not sure if I'm actually the right person to answer this question, Dr. Atri, because I think off late I have realized that I have actually not been obviously balancing it, and I'm trying to cut down my travel. So I don't think I am the right person. Maybe Radha ma'am, Dr. Vijay, Dr. Komal, and yourself, you could probably come to my rescue, like we were just discussing before the webinar. So, but yeah, right now I'm actually thinking of maybe travel not more than twice in a month, because sometimes it was actually becoming extremely exhausting even for myself, that I was practically traveling every weekend. So now I'm trying to actually cut it down to maybe twice in a month and not more than that.
Anyone else want to volunteer before I give my remarks on this question?
Can
So
put in
I
your
cut
own
it down to
remarks.
like,
Yes, go ahead.
no, ma'am, you first.
No, 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 go ahead.
So basically, I try to restrict it to once a month. Otherwise, it becomes really difficult to balance the kids and the like your workload, your calls, everything. So once a month is still quite acceptable, because once you have to go, you have to also prepare for the same. And once you come back, then there is also the workload which is pending. Your kids are waiting for you. Your husband is waiting for you. So So you have to balance out everything. So I try to restrict it to once a month.
And I
The-
think that your contributions can now continue thanks to the webinars that we have. If even if you don't travel, you are able to give an input, contribute in your own way, and also listen to others talking. You may not meet physically, but these virtual
Yes.
platforms have been wonderful in offering us a work-life balance.
I just want to give Atribai one tip. What I have been doing since many years. I was discussing with you in the group last night as well. See, I take my family to one national and one international destination every year, along with my Palmo colleagues only. Okay, so that they'll have a very good time. I'll be happy. At least I'll not be guilty that I'm not spending time. And definitely weekdays from Monday to Saturday, I my complete dedication is to hospital, which is very unfortunate, but I feel that I'm doing justice for my profession. And second important thing, Sunday I go with my kids for cycling or long drives kind of thing. And as everyone else, as Komal rightly said, I restrict my travel probably to monthly once kind of thing. Most of the times it is not practical, but I still love to restrict to monthly once.
yeah. At one point of time, it's very difficult to continue reading new. So often we learn at conference from other respected speakers talk also. So now I have restricted myself to once a month outside the state, and I make sure that I reach before the inauguration and I leave after the valediction, so that I am able to listen to the other speakers also what they want to teach. And that gives me some masala for my future talks also. And inside the state, one physical, one digital every 2 weeks. So that brings it to around, let's say, 5 lectures in a month, one outside the state in a month, and four, two physical, two digital inside a month inside the state. So that somewhere balances my family life. But yes, every quarter taking my family to a vacation, it has become mandatory now. And I do not take my family to a conference venue, because then I become divided that should I give time to the seminar or should I give time to the family. So only once I had taken them, but after that I had stopped that in a seminar I go alone. Other than seminar, once every quarter I plan a family vacation. Now, I would want to ask Dr. Radha ma'am, a career in tuberculosis, not necessary as a medical college teacher. Is there career in tuberculosis possible even in the private sector for new
Yes,
pass
yes,
outs?
definitely. See, basically, we should not be putting a compartmentalization. You can be a good pulmonologist with more emphasis on better management of TB cases, which probably an interventional pulmonologist, or for that matter, somebody like Shivani, may not have so much time to do counseling. Call them for a regular follow. So, if you do treat your patients well, you work up well those cases of TB and ensure that they get proper treatment and are followed up till cure. And of course, even after cure, if they have any issues of like residual damage with recurrent infections or obstructive airway disease, and you are able to offer good care to them, uh, helping them get rid of their symptoms, leading a near normal life. I think this is a wonderful thing. One thing which we have not discussed since the beginning of the webinar, but now that when we are discussing about career in tuberculosis, I have met few of MD pulmonology. They were girls, luckily, but they have taken up the post of consultants for these national programs. So either they are WHO consultants or they are working in other NGOs working for tuberculosis. And I think my friends, irrespective of the gender, irrespective of the place from where they have come, irrespective of the degree that they hold, whether they have a diploma, DNB, or MD, people, we should start thinking about a career in management also, means not management in the real sense like hospital management all, but the program managers, consultants for that, taking up various projects for that and implementing them and giving results. I think that is also one of the best professions that you have, or the best opportunity you would have to grow as a person and to grow as somebody different. You find a name of yourself. Imagine you are working as a WHO consultant, and one fine day you find yourself not in the same place but around somewhere where Dr. Soumya Swaminathan was, and she has made us so proud to be there in WHO as a chief scientist. So I think there are many avenues. There are MD pulmonologists I have seen who were working in NTI Bangalore. I have met people who are MD pulmonology who are working at NIRT Chennai, what you earlier called as NTI Chennai, and now it is an ICMR. It is an ICMR institute and relabeled as NIRT. So I think you can really, really choose to be a good clinician and an expert in managing TB and MDR TB and its complications. You can be, of course, a teacher in the department, as well as you can opt for being a consultant also for these public health. Second, importantly, which even if this answer is not sticking to TB, remember, non-communicable disease program has also come in our country, and COPD, asthma, or airway disorders is one of them. So, if you plan to have a career in that way, you can even go to on the other way, like not sticking to TB, but going to the NCDs and becoming consultant for that or managers for that program also. Thank you.
Whenever we are talking about fellowships, I must mention that our very own Dr. N.H. Krishna sir, he has done fellowship from United Kingdom also, and then he has done fellowship from USA also, and then he's back practicing in India. So I don't know whether Krishna sir will be able to join us, or we could ask him 2-minute comment regarding his fellowship experience. But one question I got as an audience question: how good is this course of palliative management? Anyone of us? Course in palliative management after pulmonary medicine.
Can I answer that?
Yes, please.
Yes. Palliative medicine, geriatric medicine are few branches which I think are very, very essential, because now all of us who are on this platform and many of them who have joined us at audience know that for certain diseases we cannot offer cure. That patient has to live the life with the disease. So palliative care person always offers the best possible life for that particular patient. They take into consideration the psychological, the financial situation, whether they have support at home, what is the supportive gestures of the family, whether so much of expenses should be done for a treatment of a particular disease. They would not give opinion. They would keep cards open. They would offer all the things which are available. And I'm happy to say here that one of our own pulmonologists, Dr. Gauri Kulkarni, who was earlier in Nasik, has done her course in palliative medicine and has taken it up in her practice also. So I just wish that one of them would have been here, but I understand that every person from each specialty cannot be brought. But you can go ahead with a webinar on palliative medicine and pulmonology later on.
Wow, that's a
Especially
great
for
suggestion.
diseases like ILD, COPDs, which you cannot treat, post-tuberculous residual damage or obstructive airway disease that we have, for lung cancers, for all these things, palliative medicine and ILDs, I think, is very, very important. And
Wow.
people should really actually opt, क्योंकि अभी हमारा longevity बढ़ गया है. We have learned to diagnose many diseases जो पहले हम एक अम्ब्रेला में ILD रखते थे या IPF को ही ILD समझते थे. Now हमारा विजन बढ़ गया है, हमारा knowledge बढ़ गया है. But in spite of that, the life which patient leads should be tolerable to them in one way or the other. And for that, palliative medicine has come in a great way. Many of our colleagues are practicing as full-time palliative medicine consultants. In Mumbai also, I'm sure many of you know. So I think it's a wonderful branch and people should really opt for that, provided they don't go at look at it as only a specialty, but they really, really have empathy towards the patients and sympathy towards the family.
Oh, Dr.
Hmm.
Vijay wants to add something, please. Dr. Vijay.
I totally agree with whatever Dr. Radha Munje ma'am was mentioning very clearly. If we want to see future, so one branch which requires tons and tons of specialists across India is palliative care medicine. There is no doubt about it. There's a lot of, particularly, they need lot of empathy, lot of time they have to spend with the clients and also clients' families. So, which is
And unbiased approach,
unbiased approach.
unbiased
Unbiased
and
approach.
totally ethical approach they need.
Right. So, with these
So,
qualities, if you have, definitely you are the one. You can vouch for palliative medicine. And if there are
sir, I
no
would,
comments on palliative, yeah, please, Komal.
Dr. Komal,
yeah.
please.
Yeah. So when ma'am mentioned about Dr. Gauri Kulkarni, she is also working with our department in our medical college. So so we have five consultants in our medical college, and we all are specializing in one or other things. As we mentioned, we all are working as pulmonologists, and we have our forte. So I am dealing with infectious diseases with pulmonology. She is dealing with palliative with pulmonology. There are other consultants who are doing allergy and immunology with pulmonology. So guess how our residents are blessed? They are learning everything in detail. So I'm so much proud of my residents when they are writing some antibiotic. They are much better than the medicine guys. Or the overall approach of those residents are much better when they are getting exposure to all these different kind of people at one roof. I would say.
Yeah. I have a suggestion. Means we would be very happy if you add these wonderful doctors to our CCI WhatsApp groups. So
Yes,
there can be
sure.
a wonderful interaction of knowledge also.
Yes,
Dr.
definitely.
Shivani, ma'am, as we see that the pulmonologist specialty is penetrating to the remote or rural parts of our country, let's say what procedures or intervention can we do at such places and which procedure should initially be tried to avoid at a rural or remote place? Your take on this, Dr. Shivani.
I think that's a very relevant question, Dr. Atri, like the entire discussion. But I think one thing that we must really keep in mind when we are starting something, that we can only do a procedure at whatever setup if we are equipped to deal with the complication of the procedure. If we cannot deal with the complication of a procedure, I think then we should not attempt to do the procedure at that center. I think also a rule that I have followed right from the beginning, that if I'm doing a procedure for the first time, I do like to have a senior for backup, wherein if I have a doubt, if I have a complication, if I have a problem, if I'm unable to do it, I have to be able to fall back on the senior. So I think these are two important things that I keep in mind. And then I think in rural areas, in smaller setups also, a basic bronchoscopy is very fairly easy to do. Pleural taps and of course ICDs are also something which is easily managed. And other than that, I think of course as you go on doing your basic bronchoscopies, and then you gain a little bit more confidence, you can also attempt to do biopsies, and then eventually go on to the more advanced procedures, depending on, of course, the kind of setup that you have, if you have an ICU, if you have ventilators, and all of that is definitely important. That I think the basic rule that I have is that if you're equipped to handle the complication, then you are okay to go ahead to do the procedure.
Okay, so that's wonderful. It was a wonderful discussion, but all wonderful discussions must conclude in the sake of time. And so now I would request one by one our panelists to kindly summarize your take home message for budding people. They may be people who are entering post graduation, they may be people who are completing. Oh, Dr. Vijay wants to say something. Please, Dr. Vijay. Yeah, please.
Atribai. Yes, thank you for giving me opportunity before closing it. See, another very, very important thing which we haven't discussed so far is transforming into an administrators. Okay, for which are CEOs, COOs kind of thing. The wonderful 1 year programs, 2 year programs that Pilani, ISB, IIM Ahmedabad are offering nowadays, and most of them are online programs and with probably around 1 month or so of on-site programs as well. We do have these MBA grads, they do visit or the fellowship program people, they come to Apollo Hyderabad for direct one-on-one experience with the administrators here. So that's one thing which you can really think of. Why I'm telling this is, who is the current national president of Apollo Hospitals Group is none other than Dr. Madhu Shashidhar, who was a pulmonologist at Cleveland Clinics with Dr. Atul Mehta sir team. So now he, for the past 1+ year, he is heading the Apollo Group of Hospitals as a president, national president. I'm proud to say he's one among us, one of us, and like that, the budding people, okay, budding pulmonologists, they can enter into administrative areas as well. Over to you, Atribai.
Okay. So now I would request one by one our panelists to give your concluding take home message. Dr. Radha Munje, ma'am.
I would just say to all budding pulmonologists who have just entered or just passing out or have just passed out, believe in yourself that you are on a right track. You have chosen one of the best possible profession of not only being a doctor but a pulmonologist, because we all believe in each breath counts, and you are going to give more breaths to your patient being a pulmonologist, and you are going to be much more methodical and scientific about it. That's it.
Thank you. Dr.
And
Shivani.
for sky is the
Oh,
end. For this profession, there is sky is the end. You can have a number of opportunities.
Dr. Shivani.
So firstly, before I conclude, I'd like to thank CCI, Dr. Atri, Radha ma'am, Dr. Vijay, Dr. Komal for the wonderful interaction that we've had. And last but definitely never the least, Dr. Krishna sir, Dr. Narayana Pradeep sir, for actually having these webinars every Thursday and coming up with such innovative topics. So I'm really glad to be part of this one. And to conclude, I think my take home message still remains the same, that all residents, even while they're doing their PG, they should explore all the branches of pulmonary medicine, find their passion, pursue it. And it is okay if you don't know offhand, even when you're passing out. Take your time, do general pulmonology practice. Not everybody has to do interventional pulmonology. There is so much more. You can actually choose your branch, and it is okay if you don't want to choose any branch and do general pulmonology as well. There is so much to do in pulmonology, and like ma'am said, the sky is definitely not the limit for us. I think there is so much work, so much to do, and definitely is one of the most important branches in medicine today, with the kind of disease load that we see. Definitely the most important branch. Thank you.
I would want to tell that this was Dr. Vijay's idea to do this webinar on career counseling. So, Dr. Vijay, sir, your take home points.
Yeah. See, everyone wants to be successful. Yes, success is very, very important in one's own journey, but with which we compare, it is very, very important. you have to keep yourself as a standard and grow every day. You have to stop comparing or stop feeling jealous with by looking at others. Take this as a positive attitude, and then if someone is growing, inspire from them and then start growing. But remember, success is equal to time into focus. If you invest more time, you will definitely get more success. If you invest more amount of concentrated efforts, then you're going to achieve better success. And as I think Shiv Kera was mentioning in You Can Win, one important book for personality development. Winners don't do different things. They do things differently. That's why identify your core areas of interest and then make a SWOT analysis. That is, identify your strengths, identify your weakness as well. Weakness, divide it, and whatever strengths you have got, you multiply it. Then definitely you will invariably, you need not chase against success. Okay, success will follow you. All the very best, my dear young budding pulmonologists.
Well, Shiv Khera spent a lot of his earlier life in Jharkhand, and I had the opportunity of meeting him as a school student. And I don't know whether yes or not, maybe some of his points in that school meeting had shaped my career. I do not know, but that was a fond memory you ignited in me. Dr. Komal, ma'am, please.
So everyone has said everything, nothing left for me. But just I would like to say that have patience also. So like every pulmonologist, like budding pulmonologists want to do intervention just after passing out, and they want to reach heights immediately. So have patience, as sir and everybody said. Just try to find out what is your forte, what inclines you more, and try to focus on that. Be specialized in that particular field of pulmonology while doing everything else in pulmonology, and you'll rock.
Okay, so that's wonderful. So one
Another
thing
thing
what
is
I would, yeah, Dr. Radha ma'am wants to add something.
something, yes, on the CCI platform, apart from thanking Dr. Krishna, Narayana Pradeep, Dr. Atri, and the whole team of CCI who works every week to bring up a new topic. We must emphasize that people should be happy they are in pulmonology because, because in my experience, I have observed that this is the only specialty which does hand holding for young pulmonologists, and we always want them to come up and do better, and we offer them opportunities also. So that is another reason to be happy in pulmonology.
Wow. So few points which I would want to emphasize from today's discussion. Learning never ends, research never ends. Keep on reading. Try to find opportunities to train even after passing. Select a small portion and develop it as much as you can. Try to do newer things. Smart hard work is something very good. So I would want to thank Zuventus, who were our academic partners for today, and very appreciating that today is a totally non-medical, non-clinical program, but still there is a company who is academic partner with us. Thank you everyone at CCI, Dr. Krishna sir, Dr. Narayana, our president, Dr. Ashish Dubey, secretary, Dr. Anil Maske, Dr. Nitin. He had initially agreed to be part of this webinar, and then he remembered that today was his wedding anniversary, so he requested that he would do a future webinar. And then we got together this panel. Dr. Kira, Dr. Ravi Dosi, they are part of our background, and all the panelists over here. Thank you, the technical team. If you have a suggestion, CCI is always listening. Dr. Vijay wants to add something. I saw your
Dr.
hand.
Krishna was asking in the questions that can you please repeat the name of the author of the book
Author of
of Basic for
Ashfaq.
Mechanical Medicine? Dr.
Ashfaq
Ashfaq
Hassan.
Hassan. Dr. Ashfaq Hassan.
Yeah, yeah.
Right.
Okay. So you have any suggestion for us? CCI is always listening. If you're a life member and you want to be part of a webinar, please message us. We'll be very happy to have you part of our Thursday webinars. So thank you once again. Good night to all of you. Stay safe, stay focused, and you will all have a wonderful career. Thank you.
Thank you.
Thank
Thank
you,
you,
everyone. Good night.